In this episode of the Nurse Practitioner Podcast, Dr. Wendy Wright discusses vaccine hesitancy. Thanks for joining us today, Wendy. To start, can you tell us about your background and how you got involved in this type of work?
Thank you so much to everyone who's listening today, and thank you so much, Taylor, for asking me to tell you a little bit about myself. So I'm Dr. Wendy Wright. I am both an adult and a family nurse practitioner. I am the owner of 2 nurse practitioner-owned and operated primary care clinics located in New Hampshire. I'm also an owner of Partners in Healthcare Education, a medical education company. So let's talk a little bit about how I became involved in the world of vaccines and vaccine hesitancy. Approximately 20 years ago now, I was nominated to be the nurse practitioner representative on behalf of the American Nurses Association to the New Hampshire Immunization Advisory Board. So I was the NP representative, and I spent approximately 15 or so years helping to make decisions about vaccines and what vaccines come into the state here in New Hampshire. So that's really what kicked off my passion for vaccines. But what really got me into the world of vaccine hesitancy is, number one, recognizing that vaccines are great when they're developed, but they're only as good as when they're in the arms of our patients. And finding ways to take a great vaccine and get it into the arms of patients was really important to me. And so I did my doctoral program from 2016 to 2019 at the University of Alabama. And most of the work that I did there revolved around vaccines, vaccine hesitancy, and strategies to improve vaccination rates across all age groups here in the United States. So that's a little bit about me and kind of how this conversation on vaccine hesitancy has evolved today.
Thanks, Wendy, for giving us some background on your work in education. The World Health Organization defines vaccine hesitancy as a delay in acceptance or refusal of vaccines despite availability of vaccination services. What is vaccine hesitancy to you, and how is it different from anti-vax or vaccine refusal?
So when I hear the word vaccine hesitancy, what that means to me is just that the person may be reluctant to accept the vaccine as I've recommended it that day or in combination with other vaccines. That's very, very different than vaccine refusal or being an anti-vaxxer, because in general, what we know is that people who are anti-vaxxers, we're probably not going to move them. We're not going to make much of a change in their stance. But the people who have vaccine hesitancy, and by the way, that's now the norm. In fact, when there was a study done with parents, it was estimated that over 70% of parents, or 65 to 70% of parents said, I feel the need to ask questions about the vaccine. I feel the need to ask about alternative schedules. That is what we often think of as vaccine hesitancy. It doesn't mean that they're not going to vaccinate. It just means that maybe they're not going to accept it in the way you want them to, or maybe they're just going to ask you questions about it. We call these people who are vaccine hesitant what we often refer to as the movable middle. These are people that really will vaccinate if providers take the time to make the recommendations for them. So anti-vaxxers, vaccine refusers, those folks, often you will not move them. But folks who are vaccine hesitant want you to answer their questions. And they want you to make recommendations, because when you do, the majority of them will take the vaccines as you recommended them.
Great, thanks. What impact has vaccine hesitancy had on vaccine rates prior to the pandemic?
So we know that vaccine hesitancy has had a significant impact on vaccination rates, and vaccine refusals have had a significant impact on vaccination rates. I want to take you all back for just a moment to the 2014-15 measles epidemic, or measles outbreak, that actually occurred as a result of a large amusement park here in the United States. And the CDC tracked 68 U.S. residents who developed measles from having visited that amusement park. And of those 68 residents, 43% of them were vaccine hesitant or vaccine refusers or cited some philosophical exemption to getting a vaccine as recommended. So we know that 43% of that outbreak in California could have been prevented if those individuals had either maybe had a recommendation made to them or if they were not opting out of getting a particular vaccine. But what was also really interesting was that 4% of folks in that outbreak actually had missed opportunities, which meant they were in front of providers who didn't make a recommendation on the vaccine. So we know that in the last 5, 10, 15 years, the number of people who opt out of all vaccines is rising. The good news is it's not a huge, huge number. But at the end of the day, more and more people are vaccine hesitant and want providers to be confident in their recommendations and to be knowledgeable about the different vaccines and to present that information to them so that they can make a decision about particular vaccines.
Thanks for sharing those statistics, as it really shows the role healthcare providers play in vaccine education. How common is vaccine hesitancy, and are you seeing it more often now than in the past?
You know, I haven't seen a lot of statistics out there about what percent of visits regarding vaccinations are these folks really truly vaccine hesitant. I can only give you my 30 years of clinical experience, and that is when I first became an NP, or even when I was a young child, whatever the doctor, whatever the nurse practitioner, the PA recommended to my mom said, okay, let me give this vaccine to my kid. You know, my mom was coming off of polio and coming off of measles and mumps and rubella and seeing the devastation that these diseases caused. So she would take whatever the provider recommended to her. Today, that is very rare for me to say to a patient, you're due for this vaccine, and there not to be a conversation about it. It used to be, let me make this recommendation. Yep, give my child whatever you want, or I'll take whatever you think I should have. That's few and far between today. And that truly is vaccine hesitancy. They want you to answer questions. They want you to tell them, why is it important for you to have this vaccine? And so it is imperative that when someone says to you, so why do you make that recommendation? Or do they really need to get them all at once? Providers need to take a deep breath. And you need to recognize that they feel compelled to ask questions, but the majority of them are going to take it. If you know what you're doing and you know what recommendations to make, most people are going to take it. But it is a different world today. It's a different world because people are more skeptical about vaccines. A lot of that, I believe, has to do with social media, but I think it really has changed in the last 30 years. And if I could add one other thing, I think vaccines have become harmed by their own successes. And what I mean by that is today's generation hasn't seen polio. They haven't seen rubella in babies. And that's because vaccines have done their job. So it's easier to be a little more hesitant when you think you're giving your child a vaccine to prevent a disease that doesn't even exist anymore. But we've just seen with this COVID pandemic, the implications of us being a global society and what happens in other parts of the world. You know, we're only a plane ride away from that next pandemic. And so it's imperative that we really keep up this push to make sure that we are protecting every patient that we take care of from all vaccine preventable deaths and diseases. And I think that's one of the most important things that we do.
Vaccination is one of the most successful public health interventions, whether the disease is at the forefront or not. What role does social media, podcasting, and the news play into vaccine hesitancy, since most people today look for information about vaccines on the internet and most often Google?
So I wish I could tell you that social media has played an amazingly positive role in the world of vaccines, but I think we all know that it hasn't. I think those of us who work in this space recognize that people who are anti-vaxxers are often very, very vocal, and they're often out there and willing to take on others who are a lot less vocal. And people who are advocates for vaccines are often not out there nearly as much as the people who are not advocates. So I think the first thing to recognize is this, while I told you things are changing, the protests against masks, the protests against vaccines, it's not new. In fact, I pulled up an article from the Spanish flu where there was a poster back during the Spanish flu, and it was an anti-mask meeting. So, things cycle, things come around, but social media, unfortunately, is a place where a lot of people get a lot of information. I call it the 15-second intervention. And all they have to do is see that headline. Many people never read the narrative, but those headlines are often incredibly misleading. They lead to a lot of fear and a lot of unneeded worry. And so I wish I could tell you that social media has been a really positive influence. It really hasn't. I think that people often search out opinions on social media to support what they believe. I don't think social media takes someone who is an anti-vaxxer and transforms them into a vaccine advocate. I just don't think it does. I think, in fact, it's often the other way around. And I've seen this clinically, where people who have been some of my best vaccinators for years, I'm now seeing them and they're saying, nope, I'm not going to take that shingles vaccine this year. I'm not going to take that booster vaccine. And I'll say to them, help me to understand why you're here. Well, because I don't trust what I'm hearing anymore. And that, to me, is the saddest part of what has happened as a result of this pandemic, is people aren't trusting science as much anymore. And that makes me incredibly sad. And what I say to them is, I have had a relationship with you for 30 years, and it makes me sad that you don't feel that you can trust what I'm telling you. And that is the reality. Most providers that you talk to will tell you that they're having very similar conversations with patients. It's just a tough time to try to get vaccines into the arms of our patients.
In that same vein, decision-making around vaccination entails a complex mix of factors. Aside from access issues, how does race, socioeconomic status, or other demographic information affect vaccine rates in patients?
So I think we know historically that individuals of color in general tend to have less or lower vaccination rates than individuals who are maybe white or Caucasian, et cetera. We also know that access and social determinants of health really play a role in vaccinations. Now, I'm pretty blessed in that I come to you from a state that has, it's a full access state, which basically means every child in my state has access to vaccines without regard to the ability to pay. And I think that that is just amazing. So in my opinion, there's no reason that 100% of the kids in the state of New Hampshire, where I come from, are not fully vaccinated. I know that that's unrealistic, but by taking costs and money out of the equation, it just really removes that one barrier. But the problem is that that's not the case with adults. So adults who don't have a provider, a primary care provider, adults who don't have health insurance, are often locked out of access. When a vaccine costs a person $200 a dose and they are uninsured, that's a hard decision for a lot of people to make. So having access to care, being in communities where there are not primary care providers, there was just a study that came out that said that people who have access to primary care providers are better vaccinators. They tend to take all vaccines better, and they tend to take the COVID vaccines better as well when compared to people who don't have access to a primary care. So race, ethnicity absolutely plays a role. Social determinants of health and insurance and cost of vaccinations really play a huge role as well. And so those are all just barriers that really stand in the way between people getting vaccines and not getting vaccines. Now, the good news is we've opened up the ability for other providers to really give vaccines. We now take them into the community. And we've seen this long before the COVID pandemic with influenza, taking it into schools and giving out the flu vaccine in pharmacies where people have access to that care. That really goes a long way to improving vaccination rates across the nation.
Those are indeed all important barriers we need to continue to address in order to improve vaccination rates. Are vaccine hesitancy rates similar globally as compared with the United States?
L. I don't have a good statistic on it. As I've read some of the articles from, let's say, the UK or from different places in Europe, yes, vaccine hesitancy exists there today, similarly to what it does in the United States. But there's also some pretty interesting studies that have actually shown that some of the most vaccine hesitant folks are the well-educated, white, wealthy individuals. And if you talk to providers, they'll often tell you those are some of the hardest people to get to take vaccines. And that to me is so interesting, because you would think that if you've got access to that education and you can see what vaccines have done, that you'd be more likely to be a vaccine proponent, but that is often not the case. So yes, there is vaccine hesitancy around the world. You know, that's hard for me to know that there are other parts in the world that are begging for the vaccines that we here in the United States turn away on a daily basis.
What can office staff or NPs do to increase vaccination rates in their clinics, particularly in the face of increasing hesitancy?
I have a number of suggestions, so I'd love to walk my colleagues through some of these suggestions. And the first thing I would say to you is you need to make a recommendation. And one of the things we do in every single office visit in my clinic is we look at their vaccine record. Every time you walk through the door, whether you're here for a sick visit, you're here for your physical, you're here for birth control pills, we're going to look at your vaccination records and we're going to make recommendations. Because if we don't do it while we've got them there, they're not going to come back and get the vaccine. Number two, people need to know what vaccines they need. If we don't make recommendations and look at their record, they're never going to know that they needed a particular vaccine. Number three, we need to use presumptive language. Language matters. Presumptive language is me assuming they're going to take the vaccine I recommend for them today. So an example of presumptive language would be something like this. You're in need of 2 shots today. For instance, your Tdap and your HPV vaccine. It is safe to give them together. We're going to give 1 in each arm. Let's get it done today while we've got you here. That's presumptive language. What a lot of providers do is they use participatory language. What do you think about getting your shots done today? I actually had one mom ask her 8-year-old, do you want to get your shot today? What 8-year-old says, Mommy, I'm ready for my shot? They don't. So by us giving them that out, people will take it. And so my language to people is, I'm looking at your vaccine record. You are up to date here. You are up to date there. You are due for your tetanus shot. I'm going to grab it. Let's get it on board today. And that way you don't have to come back. That type of language in a trial, using presumptive language, 74% of people walked out with the vaccine. When participatory language was used, how do you feel about those shots? Only 4% took the vaccine. So language matters. Number 4, when a patient says to you, so I'm not sure I want to take this vaccine. I call it the case model, CASE. And that's the case model for conversations around vaccines. What do? You corroborate. One of the things I'll say to them is, I'm a mom of a son too. I remember when my son was little, the varicella vaccine had just come out. And I remember thinking, does he really need a chickenpox vaccine? I had chickenpox as a kid. I did great. It's hard to be a mom. It's hard to make those decisions. So the C is corroborate. Get on their side. That will set a tone for a respectful conversation. Number 2, the A is about me. Tell them what you've done. What I say is, you know what? I spent months researching that vaccine, making sure I was comfortable with it. And then what I also say is, I spent 3 years in a doctoral program where I studied this information. And I believe that this is a good recommendation for you. I tell them about the science. That's the S in the case model. S is science. And this is where I say to them, do you know studies have shown that if you get that shingles vaccine today, it is 90% protective for the next 9 years. So there's no need for a booster shot. And yes, I know your arm is going to be sore, but you know what? 90% protection against all age groups. Let's get it on board. And then the E, explain and give your advice. I would like you to get this vaccine. I think it's important to your health. What percent of people, when you use that model, will walk out of your clinic with a vaccine? We're talking over 80%. So take a deep breath. Don't get angry. Remember that the majority of people are wanting to ask you questions. They want to find out why you're recommending that. And if they say something to you like this, well, I heard that COVID vaccine is changing my DNA. What we can then do, explain to them. I'll say to them, help me to understand how you came by that. Well, I saw it on social media. Well, let me tell you what I know about that. It doesn't touch your DNA at all. It touches your RNA. And within 3 to 5 days, that drug, that vaccine is out of your system. It doesn't alter your DNA at all. So often saying, help me to understand, or what is it about this vaccine that worries you? And that way we can address what worries them. I have a couple more recommendations, and I hope it's okay. I know I'm talking for a bit, but if you don't measure your clinical numbers, you're never going to know how well you're doing. Providers need to run reports because we think we're rock stars until we run reports. And my doctoral work showed us that when I went into offices and I said, what do you think your vaccine rates were? They would tell me 50, 60%. When I evaluated them, they were 10 to 30%. We're good at who we see. We're not good at the groups that we don't see. So you've got to run reports and you've got to put systems in place. And for me, I have a very pro-vaccine culture. What that means is everyone in our office, whether you like vaccines or don't, you best be pro-vaccine when patients come through that door. And I ask during interviews, tell me about your thoughts on vaccines, because I've worked for 30 years to improve the vaccination rates in my state. And I don't want someone in the clinic going behind us and undermining those because they're an anti-vaxxer, et cetera. So having a pro-vaccine culture, everyone's on the same page. We support vaccines and we have them in our clinic. And that's my last recommendation is if you don't have vaccines available, people are not going to get them. Because if they have to drive 30 miles down the road, they're not going to do it. So having them readily available and knowing how to bill for them is really important to improving those rates as well. So I hope that's a big synopsis. I've given you a lot of marching orders, but these are things that are based in evidence that have been shown to improve vaccination rates.
The language you used with patients does certainly matter. Do you have any final thoughts or advice on how to improve vaccination rates in the patient or parent who is hesitant?
I definitely have one final thought, and I'm hoping that the group, you'll allow me to share this with you. There was just a study that came out that talked about, what is it about certain providers that can get people to vaccinate or get people to take a medication? And the study was pretty clear. It was confidence. It was the provider's confidence in their recommendation. So we as nurse practitioners need to be confident in our recommendations. This is what I recommend for you. And I've said this to patients over the years. I've been managing you and taking care of you and partnering with you on your health for 30 years. I've treated your hypertension and I've said to you, I need you to take hydrochlorothiazide, and you've taken it. And I've said to you, your 10-year ASCVD risk is 20%, and I've told you a statin is really important to you, and you've taken it. Tell me what is different about the conversation we're having today. What is it that is making you question my recommendation to have this vaccine? And only by knowing what's different, and I've had people say to me, well, once it's injected, it's in my body. And I'll say, but you know what? Once you take that pill, it's in your body as well. Do you know that fluoxetine has an 84-hour half-life, which means it's going to be in your body for 400 hours? There's nothing different. So my recommendation to you is that this vaccine is important to you, and I recommend you get it today. Having that presumptive language, being confident in your recommendation, and holding them accountable, but being a partner with them in a respectful manner absolutely improves vaccination rates.
Thank you for your time today, Wendy, and we'll see you on the next episode of the Nurse Practitioner Podcast. You can find Wendy on Facebook, Instagram, and Twitter and you can also find the Nurse Practitioner Journal on Facebook, Instagram, Twitter, and LinkedIn. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Thanks for joining us today for the episode of the Nurse Practitioner Podcast. Before we close off the episode, we wanted to mention that the hosts of this podcast are not clinicians, and this podcast is for informational purposes only. Thanks for listening.